Hi everyone, John Rossograph here. I've been asked to give some exercises for sacroiliac joint problems. The sacroiliac joint is a joint that sits in the pelvis, so it's kind of just at the base of the lower back down here. There's one either side. It forms a triangular bone called the sacrum, and then it goes on to the ilium here. Okay, it's an important muscle attachment point for the gluteus maximus and the minimus and the medius. They all attach into this area, and the lumbar rectus spine, that's the spinal muscles of the lower back, they come down to there, the two, they join together. But it's very, very important because it acts a bit like a keystone in an arch. In other words, if for example I was this is the columns of the arch. As it comes together at the top, it gets this arch shape, and where the arch meets, this is where the keystone sits, like that. Now, if for some reason you walked off the edge of a curb, you may have knocked yourself, so the keystone is slightly dislodged at a funny angle, and that's going to give you a bit of pain, especially if you've damaged the ligaments around the side where it attaches. So what we need to try to do is get that arch into the correct position, or the position it was in and has been here for a period of time, where it's happiest, okay? So, because no one's got exactly the right length of the leg, so it's never going to be perfect, although some people are almost perfect. In the main, someone's got usually a leg at least 5 millimeters longer on one side than the other, but that's for another day. But anyway, so what can we do about it? How can we calm this down? Well, the key to this is really the pelvic floor. So your muscles you do Kegel exercises with, they attach into, from your bottom up into the tailbone, that's the coccyx, and that attaches into the sacrum. So if you've got enough tension through there, that's really going to help to pull down and sit the sacrum in the correct place. So I would certainly suggest you try those Kegel exercises. That, of course, is when you go to the toilet, you're having a wee. If you stop the flow and hold it mid-flow, that is your pelvic floor muscles you're working. So try to think about that. Now in Pilates, we like to think about the pelvic floor and the tummy muscles working together. We imagine, say, a zip that comes from your bottom, zipping all the way up to here to your tummy. So if you can get everything contracting together, like in that zip action, that will really help just to maintain the integrity of the whole pelvic bowl and get those the SI joints seated in the correct position. Now, one way we can do this to try to really stabilize it is by doing like an exercise we call leg slides, okay? And you simply lay on your back like this, and as before, you hold your tummy in to create that tension. So remember, the tension is coming from the tummy and the pelvic floor together, okay? And you simply, without moving your pelvis, and this is the hard bit, you slide your leg forward on the ground and you slide it back, drag it back, okay, very, very gently. And what's happening here is you're moving your legs away from the body. Now, if the SI joint is unstable and if your pelvic floor is weak, what will happen is the weight of the legs is going to pull the SI joint and really irritate it. So this is why we need to get you to engage your pelvic floor. If the pelvic floor is tight, as you lengthen your leg away, it's going to maintain the position and lock it in place. And that's really what we're trying to do. So something simple as just sliding the legs away one at a time will help just to reseat the SI joint where it needs to be. One thing you can do with this as well, because the SI joints, you can't really see it from the angle, but they point out at that angle there, okay, you can let the leg drop out to the side a bit, okay, and that encourages it to go in the direction of the plane of the motion. So as we do this, you can drop your leg out to the side, slide down, and then come back up again. And the same thing on the other side, let the other knee drop to the other side, slide down, and come back up again. You can't see that very clearly, so I'll do it from this side again. So drop to the side, slide the leg down, and up again, and drop the other leg down to the side, slide down, and bring it back up again. But like I said, you must keep the pelvic floor really tight. If your pelvic floor is loose, it's not going to do any good at all. Probably, in fact, it will irritate it, okay? So if you're finding you cannot contract your pelvic floor strong enough and this still hurts when you're doing this, you're not at that stage yet to do it. So just think about working your pelvic floor, holding your tummy in. Now, the other thing you can do that may assist with this as well is to forcibly seat the sacrum in the correct place. And one way we do that is with squats, okay? Not single-legged, definitely not, but with a two-legged squat. So simply coming up to a squatting position here, and you can't really see me very clearly, can you? So let me just bring this back out like that. So you're standing here. Ideally, put a chair behind you so you know how far you can go. You're not going to bash into this, so you may even want to put a cushion on top, okay? Just sit down and as if you're doing a squat this way. Think about putting your bum out behind you and dropping onto that, okay? You're not going to bend like this, you're not bending your back, you're bending the hips only, so you're dropping onto there and coming up again. Dropping down and coming up again. So if you notice, the knees and the hips are working proportionally. So again, watch yourself in the mirror if you can as you do this motion. Back and forth, okay? And that should go some way to give you some kind of relief from your sacroiliitis. But again, even with these exercises, if they hurt, you probably should stop, and you're probably not ready for that yet. You need to let everything calm down a bit. So maybe a bit of ice packing, sometimes even hot water bottles, just to make those muscles feel nicer and warmer and softer. I mean, once you get the heat into that, it'll get the blood supply into it, which will then fix any strain you've got. And this is the important thing, is determining whether the pain is because the SI joint is out of position, or if it's because the ligaments around it have been damaged. And you have to be aware the ligaments can take up to 6 weeks to get better. I mean, it's unlikely you're going to be in pain for 6 weeks, but nevertheless, you still need to give it time, and don't force the exercises. Definitely not. Sometimes you're better off leaving it slightly longer than you would normally do before you do those exercises. But give those two a try. They're worth doing, and they should give you some relief and go to bring your body back to its natural position again. All right. Signing out. See you in the next video. Take care. Bye bye.